Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist, and today I'm going to be reacting to the music video for Sick Boy by Ren. I've only ever done one reaction video previously, which was for Hi Ren, and that was specifically because one of my clients asked me to. She asked me to pause at regular intervals to give my initial thoughts and impressions as the video was going along, which I appreciate is not everyone's preferred style of reaction video, but it was made specifically for her. Since then, I have had hundreds and thousands of renegades respond, which I was not expecting, and loads of you have commented that you would like to see a reaction to Sick Boy. So I will do my best to provide that. I'm assuming the music video is something to do with his chronic illness. I know he's had Lyme disease, so I will have a look and see.
Hi Ren, thank you for coming in today.
Thanks for seeing me.
Looking at your file here, it seems there's a very apparent interplay with your emotional state and your physical body. Have you ever heard of the trauma response?
I don't think so.
Basically, our bodies can get stuck in a negative feedback loop. Our subconscious can repeat patterns from the past, which can have a pretty drastic downstream effect on our biology. Essentially, your mind is making you sick.
Sick boy, bitten by a tick boy, looking for that fix boy, anabolic steroids, stem cell, poster boy, pass out, white noise, quick fix, snake oil, I'm about to break boy. Oh, what a shame, he's in pain, have another go, take another pill, here, take a couple more, let's see how you're doing in another week or so, you'll be feeling worse when the side effects will show, derealization, medical patient, losing patience with the process, walking hand in hand with Satan, complications with the medication, inflammation, dehydration, inhalation, aggravation, building up a toleration, drown, soccer, drown, soccer, drown, soccer, drown, I've been feeling like I'm drowning with my feet upon the ground, I've been screaming, I've been shouting, but I never make a sound, I've been looking for a way out, but I always seem to drown.
Is this all making sense, Ren?
Yeah, I think so.
Good. What I propose we do is we try to pinpoint the exact experiences from the past that are keeping you stuck. What can you tell me about your childhood?
I can't really think.
It's okay if nothing comes up right away. What I'd like you to do is take some deep breaths with me. In and out. In and out. Good. Now tell me the first thing that comes to your mind.
Maybe that's an okay moment to pause. It's been quite a lot to take in so far. I mean, firstly, I can see why I've been asked to watch this. As you know, a psychologist, it is definitely kind of relevant. At the same time, it is incredibly uncomfortable to watch. Partly because of his kind of distress, which in the form of the grunting and his kind of expressions and talking about feeling basically silenced and dismissed by professionals, but also just watching how she was responding to him, and there's just no compassion, no empathy. It's very difficult to watch someone responding so badly in a therapeutic setting. I'm not sure if she is meant to represent a psychologist. The fact that she has medication makes me think that perhaps not, because psychologists don't prescribe medication. It's normally psychiatrists who do, or whether she's a doctor, or perhaps she's just kind of representing professionals in general that he's kind of come into contact with. But the way that she jumps straight into what she's read about him in his file and the assumptions that she's made about that, and straight into telling him what is wrong with him without even actually having any conversation with him about his experience of those difficulties and his understanding of them. And a lot of the things in his file could be completely inaccurate. assumptions that other professionals have made that haven't been correct. So it's always really important to have a proper conversation with someone, and find out from them what they feel is going on, and come to a shared understanding, and then, based on that, agree a treatment together, rather than jumping straight in with, oh, this is what's wrong with you, you need to do some breathing. So yeah, it comes across as very dismissive, not really treating him as a person. It's almost scripted, manualized kind of response. So that in itself is very difficult to watch. And even when he's really distressed, she's not even looking at him. She's kind of just looking at her clipboard and ignoring it, and not kind of responding in a helpful, compassionate way towards it. So yeah, that's difficult in itself. I'll talk about perhaps the actual content of what she's discussed with him at the end, because I just want to see if there's kind of more to it, or that's the thing before I respond to that. But yeah, so far, I mean, amazing kind of lyrics and music, and he's very talented. At the same time, it is uncomfortable to watch because of the kind of content of it.
And out. In and out. Good. Now tell me the first thing that comes to your mind.
I feel like it's not me, it's the world that's sick. We're given everything we need and we commoditize it. We consume, we destroy like we're parasitic. Science tells us that it's suicide and still we commit. I'm not sick, we are sick. We are standing on a cliff in the name of progress. We jump off the precipice. I'm not sick, I'm the virus, you're the virus, hypocrite. How can you sit there with that smile on and tell me that I'm sick? Sick boy, looking for a fix, boy. Push it down in public, quick pose for the pick, boy. Record label meetings that commodify your gift, boy. Why you so upset? Don't you wanna be a rich boy? Fuck no, industry is cutthroat. I've been doing bits by myself, swimming backstroke, walking on a tightrope, rapping with a slit throat. The way that we persist is like the ending of a bad joke. As the people evolve, we're complacent to assailants and we do what we're told. Counterintelligence, a sight to behold. Rape the earth of all resources and we bleed it for gold. And we bleed it for wealth, we bleed it for fame. But when you bleed it, can you tell me what the fuck will remain? And I bleed in myself, I bleed in my brain. While I'm bleeding, I'm the reason, cause I'm doing the same.
Wow. I mean, that there's a lot to talk about in response to that. Firstly, the sort of the main content about the conversation between him and the therapist, it brings up a lot of sort of internal conflict for me, because I have been, and still am, someone with chronic health issues. So I had ME for 12 years. I, spent time in a wheelchair. I couldn't do the things I wanted to do. I was on 90 tablets a day at one point. It was very, very difficult. And I've also had, I now struggle with recurrent pericarditis. I had it for 3 months last year, 8 months this year. It's actually still ongoing. And throughout those experiences, I have had professionals be very dismissive of it. I have had people say, oh, you're just fatigued because, it must be that you're depressed, or you have chest pains. It must be that you've got anxiety or something like that. And just being, dismissed or told that there's nothing wrong, that you're just a hypochondriac, that you're wasting people's time, or you're being lazy, or that's the thing. And those responses are so damaging, and, really do have a horrendous effect on people. And I was very lucky that, I did manage to fight to see specialists who did then say, oh, actually, yeah, we can see that there's inflammation of the lining of your heart, or fluid around your heart. There are like real, things going on. It isn't just something that's in your head. So I can understand that side of things. And, watching his interaction with this therapist does bring up some of those memories and that sort of thing. At the same time, I am a mental health professional, and so I can also see that side to this video. So some of the things that she was saying do have some truth in them. So trauma can affect your physical health, and there are links in general between our physical and our mental health. So if you have health problems, you're more susceptible to mental health difficulties. Equally, if you have mental health difficulties, sometimes that can manifest as physical symptoms. So there is some truth to what she's saying. I think the problem is that, firstly, she's saying it in a way that is, lacking compassion and completely inappropriate. And secondly, that actually it's not true for this particular client, for Ren. Actually, it's that doctors have missed something. So she's telling him, this is what's wrong with you and this is what you need to do, when actually that's not the case. They haven't done a thorough enough assessment. They haven't, properly kind of formulated his difficulties and come to a shared understanding with him. So yeah, the way that she said it is inappropriate. The fact that she said it to him is inappropriate, but there are still elements of what she's saying that do have some truth and some, relevance for other people. And I think often we can get this unhelpful situation where people are being dismissed when they actually do have, physical health problems, because mental health staff don't get enough training on physical health difficulties, and because, staff, both, medical and mental health staff, often are, they're lacking resources, they're very short on time. We have GP appointments where you have to manage to do everything in 10 minutes. So I think there are huge pressures on staff, and they can very easily make these mistakes or come to incorrect assumptions, or not kind of do things as thoroughly as they perhaps want to and should. And that's not to excuse this. Clearly, we need to provide better care for our clients. We need to educate ourselves about, these other conditions that, physical health conditions that can have psychiatric symptoms, and that sort of thing. We really need to listen to our clients. I think that's the most important part, not just to go in thinking, oh, I'm the expert and I know what's going on, but actually to sit with them and listen to kind of their experiences more thoroughly. So I think, yeah, it's such a huge issue. It's something that I could probably discuss all day, and it's something that we need to be trying to address in services, rather than ending up kind of further traumatizing people as a result of us, failing in providing the care initially. So that was the kind of the content of their discussion initially, but then it seemed to the last section seemed to really kind of expand out to wider society, and that sense of actually a lot of the time it's not the individual who is the problem, it's the wider kind of system that they're in, which fits really well with so I've got training in systemic family therapy, and actually there's a lot of that kind of thinking in terms of, like, when we work with families, you'll often have cases where they will want to locate the problem within an individual. So it'll be like, oh, the child's the problem, they're the one that's acting out, they're the ones that have the mental health problems, when actually they're not the kind of the main problem. It's actually this wider system, the rest of the family. There's unhelpful dynamics between them. There's wider systemic things that are happening, and it's not one individual that's the problem. And it's the same with wider society. It's not often the things that we're struggling with are the result of things in society. So there's loads of messages around that actually you can only be happy if you're rich or famous, or you get more and more stuff, which I think is kind of what he's touching on. You know, he seems to talk quite a lot about greed, and my understanding from people's comments is that the pig's head does often represent greed. I don't know if it also represents kind of mental health professionals or you know, doctors and that sort of thing as well. But it seems that, yeah, he's kind of linked the song in with much wider issues towards the end. And it sounds like that's something that he's really passionate about, and something that, you know, when he's creating his music, he's not doing it to get loads of money. Actually, he's doing it because it's meaningful for him, and it's, you know, he's got important things that he wants to talk about. And I'm very glad that you guys have shared this with me, you know, and that I've had a chance to kind of watch it and share some reflections on it. As always, you know, there will be some things I've said that you probably don't agree with, or that might be inaccurate, and that's the thing. And I hope that you will kind of understand that these are just initial thoughts based on watching a music video once. And I'm sure that once I've watched it multiple times, you know, my thoughts on it might change, and that, yeah, there are so many different perspectives to the same issue. So yeah, I hope that there has been something useful from that. And yeah, I will try and look at some of your other requests in future. It just might take me a while. So thank you very much.